Hello, I'm Ken Tanabe. I have the privilege and honor of serving as the president of the Society of Surgical Oncology. Today, I have with me Chris Puleo, who is the chair of the Advanced Practice Providers Committee. And I thought this would be a great opportunity to introduce the membership and our viewers to Chris and the work that his committee is doing. So, Chris, may I ask you to introduce yourself?
Sure. My name is Chris Puleo. I am actually recently retired. I spent about 35 years at the H. Lee Moffitt Cancer Center doing surgical oncology and helping to build their APP program there, as well as the work that I'm trying to do now with the SSO.
Terrific, terrific. Well, Chris, tell me, how has the scope of advanced practice providers changed, we'll just say, I mean, you've been in practice for a long time. I recently retired, but why don't we just say over the last 10 years, maybe?
Sure. Actually, over the last 10 years, the scope of practice of APPs, especially within surgical practices, has been growing very, very rapidly. And it's exponentially growing, especially in the fields of surgical oncology and in all of the surgical practice type models. The integration of PAs and nurse practitioners in a surgical practice has begun to really influence how surgeons provide the care in their office, as well as across their practices within inpatient and outpatient surgical settings. Specialties like surgical oncology have learned to incorporate APPs into their practice models to help to provide for the challenges of timely access and care to their patients. With respect to academia, and I think that this is a very important point, you as a physician in an academic setting have had for a number of years a plethora of residents and fellows that have come through your service, and they're required to do this in order to continue and complete their active training. But during that time, as these residents and fellows continue to come and go, the gatekeepers of your practice have become your APPs. They're the people there that provide the stability in your practice. I don't know how many times over the years I've had the attendings that I've worked with, ask me to keep an eye on the fellow, keep an eye on the resident, make sure that they're following the protocols of our institution, that they're making the best use of all the academic resources that they have here, and just kind of push them along and help them along the way. So I think that the APPs have become extremely useful in the academic training of the residents and the fellows over the years.
Oh, absolutely. That resonates with me so much. I mean, certainly when I started my practice, there were no APPs, and now they are so well integrated and such an important part of care delivery. And also, as you point out, there are a lot of rules on education and how they integrate with the residents as well. I feel very fortunate to have a group of terrific APPs in our practice. And I do agree with you that they are very well integrated into the fabric of surgical oncology here. So I think we are benefiting in seeing the role, the important role of APPs in surgical oncology. We want to be sure that the SSO is positioned to help this group of providers. And so, from your perspective, what can the SSO do to be of greater help to APPs?
Well, you've actually done the first great thing. I was asked a number of years ago by the past president, Russ Berman, to sit on the first APP task force to try and see if there were some things that the SSO could do to try and get APPs more involved with the society. And after that first year, we had had such a good success that they decided to make us a full committee, which was quite a feather in our cap that we were able to join the society as a full committee and to be represented within the society. So I guess the first best thing is that you guys have provided support and that you continue to provide support for the APPs. The other thing is to provide continued mentorship with the APPs that are within the SSO so that they can then mentor the APPs at their own institutions. The membership committee at the SSO can continue to provide a push for APPs to become members. They should also continue to encourage them to become members of committees so that they can help to grow the society as they become more involved and more populous in that society. Okay. They can offer tailored educational resources specifically designed for how APPs practice within surgical oncology. We've done a number of things that have helped APPs in the long run. It's just the small things. They decrease the membership fees, which help to promote. A lot of APPs have limited funds in order to become members of societies and to go to events, and the SSO is doing everything that they can to try and make the availability of the society to the APPs as easy as possible.
Yeah, I think all of those things are important. In the same breath, so we have about 100, 125 APPs, something like that in our society. And I don't know the actual number, but I'm going to guess in the thousands in the country that are part of this surgical oncology fabric, if you will, helping providers on the inpatient side and the outpatient side. And so, the limited number that we have in our society suggests that we can do a lot better. You've mentioned some of the things that the society is doing. Are there things that surgeons or surgical oncology SSO members can do to help grow the membership?
Sure. The number one thing there is just inform them of the society being in existence. I myself have found that when I was first introduced to the society, that I found it to be an incredibly invaluable resource for me within the practice of surgical oncology. I could come to that meeting and over a 3-day period get a lot of very, very specific knowledge and information and up-to-date resources that were provided to me that had to do specifically with surgical oncology and were very, very basic to my practice. A lot of people don't realize that, as I said before, the APPs are the gatekeepers of your practice. And even though you're in the business of training residents and fellows, your APPs need to become just as knowledgeable as those residents and fellows, and they need the same resources, the same information, and the same academic training that the residents and the fellows get in order for them to continue to be very successful within their departments. And so it's the availability that their surgeons and their attendings can give them to become members of the society that I think is the best thing that they can do. More often than not, and I have found that I had talked to a number of APPs and I said, well, you should come to the meeting. And they're like, well, yeah, my attending is a member of the society and they go to the meeting and I have to stay home and keep things running while they're gone. And so we actually are in the process of attempting to set something up so that if an attending brings their APP along with them, they can get kind of a group rate to the meeting, anything to try and make them more inclusive along with their membership in the society.
Yeah, that's a good thought. And I definitely hear what you're saying, though, that a lot of times they're the ones who get caught holding the bag. Listen, you mentioned some of the types of activities that the SSO sponsors that are of interest to our APPs, but are there additional types of events or sessions at our annual meeting that the APPs generally look forward to?
Sure. One of the things that the APP committee, like the other committees, has been tasked with is that we host a session that's basically tailored to APP interests, such as a networking lunch that we have every year. We have our own didactic session where we bring up topics not only with respect to the care and treatment in surgical oncology, but also things that drive APPs within their practice. all of our APP registrants are invited to attend the luncheon that we have. We provide a forum to connect with the peers, share ideas. We offer suggestions how the APPs can become more engaged with the society. I think the society can work a little bit more with trying to partner with some of the other external societies that APPs belong to. Things like the APAO, the Association of Physician Assistants in Oncology. We have a number of surgical societies that are also specializing not only in general surgery, but different types of surgical oncology. And we're hoping that the society will try and partner more with those organizations to give us more of a broad spectrum of reach for the APPs.
That is terrific. One of the things that you mentioned is networking. And I'm hearing that throughout my conversations with members of the SSO, that one of the important values of membership in the SSO is networking. And I think we can provide a better space for networking for our APPs. We did recently launch peer network groups, and I am certain that I did not see on that list a peer network group for APPs. And I am very certain that I'm going to talk with our leadership, which I guess includes me, but about including APPs as a peer network group. I think that's a wonderful point that you've made. What are some of the other projects that are currently underway from your committee there?
Well, one of the main things that we've done is we've created this comprehensive onboarding module. Okay, it's designed to support both new and existing APPs. It's providing a standardized roadmap featuring defined onboarding timelines, a clinical competency checklist, structured didactic curriculum, and supervised clinical competency and hands-on with procedural training. In addition, the committee is also actively working on several educational initiatives to enhance professional development and engagement for the APP members. As I said before, we've helped to lower the fees. We've created an APP travel scholarship for the ACT meeting. We've also created our APP website within the SSO. We're showing videos that are tied to the SSO videos and have a list of a number of resources that are there. We're continuing to plan and execute APP symposiums for the next meetings like we have for the last two. And we're going to try and increase APP membership through our outreach. And you had mentioned before about the networking program, and funny that you should mention that. We've been discussing that for the last 2 weeks and are debating on a name for that networking program as we speak. So we are aware of that deficit and are continuing to work on that.
Well, it's really incredible, all of the work that your committee is doing. As you said, it's a new committee. Your team has hit the ground running. Your team has hit the ground sprinting. And the SSO is really appreciative and benefits from your terrific work. Thank you very much.
Thank you for allowing us to become members of the SSO. It's truly been an enjoyable experience for me for the last 35 years.